Hello and good morning. My name is Madison Daggett, and I'll be presenting my project over advances in Alzheimer's research. First, I want to start with some background information just so we can understand later on in the presentation. First, what is Alzheimer's disease? It's a type of progressive fatal dementia. Dementia is a loss of cognitive function. This can be episodic memory, semantic memory, anterogate amnesia, and many more. It is progressive, so it gets worse over time. It also is fatal. The brain deteriorates, unfortunately, until death occurs. The prominent features of this disease is memory loss, followed by other cognitive impairments, such as psychological as well. It is characterized by normal functioning of the amyloid beta protein and the tau protein, which I will dive in more deeper later on. First, I want to talk about some prevalence numbers. First, I want to stress the strain on the caregivers. 78% of caregivers are family members. 58% of family members report extreme stress from having to take care of them. 47% experience loss of sleep from having to sometimes become their complete caregivers. 35.5% did not reach out for help from others just because they're embarrassed about needing help from others. 57% must go to work late, leave early, or take time off, which can create great financial strain on them, especially if maybe they might be the only financial income of the family. Now, there's also great strain on the healthcare system. 39.9% of providers never or only sometimes feel comfortable with diagnosing Alzheimer's. This can be due just to how deadly it is and not wanting to give the family members stress. 50% said medicine is not prepared for the uproar in cases, which truly it is not. 55% report shortages of Alzheimer's specialists alone. One thing I want to stress is geriatrician care. These are doctors that are focused on patients 50 and older who focus on diseases of Alzheimer's, Parkinson's, Huntington's, and many more that focus with coming of older age. As of 2021, 16.7 million people were needed from care for geriatricians. And for those, we need at least 23,933 geriatricians. In 2021, there's only 7,454 board certified alone. This clearly shows how the healthcare system is truly not prepared. Now I want to talk about progression of the symptoms, which is highly important when we talk about the different vaccines and things that are available now. First, I want to talk about the early stage, which lasts 2 to 4 years. This comes with memory loss, wandering and getting lost, mood changes, and personality changes. This can be due to many things with the brain deteriorating, and we want to try to diagnose in this time, but if not, it comes into the middle stage of 2 to 10 years. This is longer due to the treatments that are available that can be used during this time. In this comes increased confusion, social withdrawal, impulsiveness, restlessness, and agitation. Now into the later stage, which lasts 1 to 3 years, and this is shorter due to how much the brain's already deteriorated, and this is where death does occur. It comes with limited communication, seizures, limited awareness, and physical decline. And in this image, you can clearly see the healthy brain being full of connections. And in the severe Alzheimer's, we can see the clear deterioration in the patient. Now to talk about the proteins I mentioned earlier, the amyloid beta protein and the tau protein. In the amyloid beta protein, it modulates synaptic plasticity, aiding learning and memory. It also promotes neuron survival and growth. But in Alzheimer's patients, it forms plaques, where it comes together. And when it comes together, it blocks synaptic connections as well, so it's unable to perform its normal role. In tau protein, it stabilizes in microtubules, and microtubules are critical for axonal transport and maintaining neuron structure. Without it, we would not have the structure of the neuron. In Alzheimer's patients, the tau becomes dysfunctional, and microtubules become tangled inside the neuron. And these tangles are called neurofibril tangles. Now I want to highlight an image just so we can understand a little bit more about this. In the normal one, we can see there's no amyloid plaques. Amyloid is doing what it's supposed to do in the glial matrix. Inside neurons, we can also see they're clear, and the tau protein is maintaining the structure. Now the patient with Alzheimer's disease, we see the amyloid plaques, which is amyloid beta protein clumping together. And these are now causing synaptic connections to not be able to go to where they need to. And inside the neuron, we can see these tangles, which are the tau protein, becoming tangled up. One thing I want to highlight, and this is the main target of Alzheimer's in the brain, is the hippocampus. This is critical for episodic memory, which is recalling events that have occurred. This also is for the what, when, and where an event happened in your life, and remembering that. And also we have semantic memory as well, which is critical memory as well. Now, in the early stages of Alzheimer's, there's a rapid loss of tissue in the hippocampus. This can then cause anterogate amnesia, which is the inability to form new memories. The old memories can remain intact in the early stage of Alzheimer's, but profound confusion in the later stages of what exactly happened event, where exactly happened, and when it exactly happened. Now, what is currently available? The primary treatments are pharmaceutical. They're prescribed by a doctor based on what symptoms you're having and where you are in your Alzheimer's disease. The general goal of these are to slow progression of the disease, mitigate the symptoms, and extend the lifetime of the patient. Some of the target options enhance the neurotransmitter signaling to compensate for the cognitive problems, such as the ones we highlighted in the hippocampus of anterogate amnesia, episodic memory, and the semantic memory. Some medications also target other symptoms, such as anxiety, insomnia, and many psychological ones. Some newer medications target removing the beta amyloid proteins themselves. There's a huge limitation of these, though. They do not cure or stop the disease, which is very unfortunate that we don't have this quite yet. It can only increase the quality of life for a while, and even when the symptoms aren't being noticeable, there's underlying disease still there. It is still deteriorating the brain slowly and progressively. First pharmaceutical options I want to highlight are the cognitive symptoms. They're separated into two main categories, the cholinesterase inhibitors and the NMDA receptor antagonists, which are your glutamate antagonists. First, the cholinesterase inhibitors. They're prescribed to treat memory, thinking, language, and many other cognitive symptoms. Their goal is to enhance acetylcholine signaling. The first one is benzgalantamine, which is also known as Zunvil, and it treats mild to moderate Alzheimer's. Donepezil, also known as Aricept, which they treat mild to severe, and galantamine, which is also known as Rosidine, to treat mild to moderate. Now for the NMDA receptor antagonists. The one I want to highlight is memantine, which is also known as Nemeda. This is the primary option in the later stages of Alzheimer's. All these provide modest temporary relief for the cognitive symptoms one Alzheimer's patient can be experiencing. Now for the drugs that treat the non-cognitive symptoms. These ones treat the behavioral and psychological symptoms, which are also known as atypical antipsychotics. These ones target the dopamine and serotonin receptors on the neuron. First one I highlight is brexpiprazole, also known as Brexulti, which is treat agitation symptoms. Suvorexant, which is also known as Belsomra, which is treat insomnia and shown to be effective in mild to moderate stages. Now for the newer options, which are truly showing the research coming in hand a little bit, are the ones that target the disease progression. These ones are anti-amyloid IV infusions. These target the amyloid beta protein straight on and keep them from coming into plaques. First one to highlight is donanemab, which is also called Kinsella. This is every 4 weeks, an IV infusion. And then lecanemab, which is also called Leqembi, which is every 2 weeks IV infusion. Both are used when cognitive symptoms are mild to moderate, and these can slow the progression of disease by about 30%, which shows that we are getting there in slowing this disease and even being possible in treating it. Now for the recent research that's come up, which has truly been showing that we are coming up and knowing about Alzheimer's more. First, we found differences in ethnic groups. The tau protein buildup is different in non-Hispanic and white population along with African Americans. There tends to be less build in temporal lobe in non-Hispanic and white populations versus African Americans. There also tends to be a difference in the environmental factors. These can make a difference in the onset and severity of Alzheimer's. This can be due to poor sanitation, nutrition, and many other different ones. Now for the recent research strategies. Their goal is to treat and prevent Alzheimer's, which I hope is a guaranteed thing that we have in the future. They've been doing this by finding newer and better anti-amyloid treatments than the ones that are currently available. Again, these will target amyloid beta proteins that are coming together and clumping. They're also working on anti-tau treatments to keep from the neurofibrils from coming up and tangling. And they're also working on possible vaccines for Alzheimer's. These medications are there to decrease neurodegeneration, and they're also genetic-based. Now for one research I want to highlight is Schuyler and Scott. His goal was to impede the production of tau molecules. He would do this by using a gene manipulation strategy using antisense nucleotide. These binds to the gene for tau and prevents more tau from being produced. His trial lasted 12 to 24 weeks for about 18 months. He had about 300 participants ages 50 through 80 diagnosed with Alzheimer's or conditions preceding Alzheimer's. He would use a placebo or nucleotide and inject it into the fluid around the spinal cord, and he would see if this would bind to the tau and prevent it from tangling. And this hopefully prevent neurofiber tangles from forming and coming together. Now, another one I want to mention is McNo. His goal is to stop tau aggregation, thus decreasing neurofiber tangles. There's a clear theme here of they're trying to target the tau protein. His hypothesis, he used human leukocyte antigen DR4, which interrupts tau aggregation. He found this as a benign autoimmune disease. A subsection of the tau protein called PHF6 is stickier than other regions of the tau protein. So PHF6 sticks to other PHF6, which comes together to make the clump of tau. In his upcoming experiment, he gives mice a PHF6 targeted vaccine. His hope is to create a vaccine that can delay or even prevent Alzheimer's. And the last researcher I want to highlight is Longo. He found the P75NTR protein, which is responsible for synaptic pruning. In Alzheimer's, it has overactivity, which is associated with neurodegeneration. In his experiment, he used a molecule that targets P75NTR, which would create resilience to amyloid or tau-related degeneration. His conclusion, he found the compound LM11A31 drug, which selectively interferes with the P75NTR's activity. He found this as alternative to pricey Alzheimer's drugs on the market if it gets approved. This one is still waiting on phase 3 clinical trials, which shows it's very close to being a possibility. Now, is there hope for the future? In my opinion, there truly is. We'll be coming up with new discoveries every year. New proteins, products and treatments, new methods, and also being able to diagnose it better because of our awareness of it. In the healthcare system, we saw the strain on how much it's taking on with Alzheimer's, and there has been creation of programs to enhance the number of specialists. This comes with NDWS, National Dementia Workforce Study, the GWEPS, Geriatrics Workforce Enhancement Program, and AD Dementia Care, ECHO, which is there to support family members who are taking care of their family member with Alzheimer's. I want to say a huge thanks to Dr. Nolan, who's helped me along this project, along with my friends and family who supported me along the way. I also want to thanks for coming out this morning to watch my presentation, and I want to show my resources.